Let me ask you something that most doctors will never say out loud. What if some of the medical checkups you've been told are absolutely necessary, the ones your doctor schedules every single year, are actually doing more harm than good after a certain age? I know, that sounds shocking. But stay with me. Here's what most people don't realize. The standard medical screening guidelines were designed for the general population, not specifically for people over 65. And after 65, your body responds very differently to certain tests and screenings. What was once helpful can set off a chain reaction, more tests, more worry, more procedures that ends up causing more harm than the original condition ever would have. This is called overdiagnosis, and it's one of the most overlooked problems in modern medicine for older adults. Today I'm walking you through 5 specific checkups that many leading health experts believe people over 65 should seriously reconsider. I'll tell you why, what the real risks are, and what to do instead. And before we go further, I'm not telling you to stop seeing your doctor. I'm saying knowledge is power. Every person over 65 deserves to walk into their doctor's office fully informed, asking the right questions. This changes everything. Let's get into it. Most of us grew up believing more testing is always better. More screening, more results. That's how you catch problems early, right? For most of your life, through your 30 seconds, 40 seconds, and 50 seconds, that thinking makes sense. But here's what happens after 65 that most people never get told. Your body changes in ways that make certain tests far more likely to produce a false positive. That's when a test looks concerning. But when you dig deeper, there's actually nothing wrong at all. The problem is, a false positive doesn't just go away. It triggers the next test, and the next, sometimes a biopsy, or a procedure, or a surgery, and each step carries its own risks. Here's the real hidden cause most patients never hear about. It's not the disease they were looking for that caused the damage. It's the testing cascade itself. Now let's go through all 5, one by one. Checkup number 1, annual PSA testing for men over 70. The PSA test, prostate-specific antigen, is a simple blood test that's been a cornerstone of men's health for decades. The idea is simple. Elevated PSA might mean something is happening in the prostate. Let's check it out. Here's what most people don't realize after age 70. Almost all men who live long enough will develop some form of low-grade prostate cell changes. The prostate grows with age. PSA levels rise naturally with age, and the changes that often show up in men over 70 are what doctors call clinically insignificant, meaning they would never have caused a symptom, never shortened that man's life. But here's where the hidden damage begins. An elevated PSA leads to a biopsy. A biopsy carries real risks: infection, bleeding, serious complications. And if the biopsy finds anything at all, treatment is often recommended. Surgery, radiation, hormone therapy, these can cause incontinence, sexual dysfunction, and serious reduction in quality of life. For a man of 74 living comfortably with a slow-growing change he never felt, the treatment causes more damage than the condition ever would have. Robert was 72, active, healthy, walking 3 miles a day. A routine PSA test came back slightly elevated. What followed was months of anxiety, a biopsy that caused an infection requiring hospitalization, and ultimately a diagnosis 2 specialists agreed needed no treatment. 8 months of fear, a medical complication, and he ended up exactly where he started. The U.S. Preventive Services Task Force now says for men over 70, routine PSA screening is generally not recommended because potential harms outweigh the benefits for most men in that age group. What should you do instead? If you have a family history of aggressive prostate cancer or symptoms like difficulty urinating, pain, or blood, absolutely talk to your doctor. Those are real warning signs. But a routine annual PSA for a healthy, symptom-free man over 70, that deserves a real conversation first. Checkup number 2, annual mammograms for women over 74. Mammography has saved countless lives. For women in their 40 seconds, 50 seconds, and 60 seconds, the data is strong. I want to be clear about that. But what happens after 74? Here's what most people don't realize. After menopause, breast tissue becomes more fatty and less dense. And as that happens, mammograms actually start catching more things, more spots, more calcifications, more small masses. That sounds like a good thing. But here's the problem. Many of these findings in older women are changes that would never progress, never become life-threatening. Medicine calls them indolent lesions, slow, non-threatening, harmless. But they show up. And once they show up, the cascade begins. Additional imaging, then a biopsy. Biopsies in older women managing arthritis or osteoporosis are physically stressful, and then treatment may be recommended for something that would never have harmed them. Margaret was 76. She'd had annual mammograms since her 42nd. 1 year, a small cluster of calcifications appeared. Nothing anyone could feel. Nothing causing symptoms. But it triggered 6 months of follow-up imaging, a needle biopsy, and enormous psychological distress for her entire family. The conclusion? A benign finding. No treatment needed. She told her daughter afterward, "I was terrified for 6 months over something that turned out to be nothing." Major health organizations now acknowledge that for women over 74, the decision to continue annual mammograms should be individualized. A real conversation between a woman and her doctor about her personal risk, her health, her values. If you have a strong family history of breast cancer, genetic risk factors, or prior abnormal findings, the picture is different. Talk to your doctor. But the idea that every woman over 74 must get an annual mammogram with no conversation needed, that's worth examining. Checkup number 3. Aggressive blood sugar control. After 70. This one affects tens of millions of people, and this one genuinely surprises most people when they hear it. If you or someone you love has type 2 diabetes, you've been told tight blood sugar control is everything. Keep the numbers low. Keep the HbA1c down. Stay in range. For most of your life, absolutely correct. But here's what most people don't appreciate about glucose control after age 70. The real problem starts when you apply the same tight targets to a 72-year-old that you'd use for a 45-year-old. As we age, the early warning system for low blood sugar, hypoglycemia, becomes significantly less reliable. In a younger person, dropping blood sugar sends strong signals: shakiness, sweating, pounding heart. You feel it and you act. But in older adults, these warning signs become muted, blunted. Sometimes they disappear almost entirely. This is called hypoglycemia unawareness, far more common after 65 than most patients are ever told. So what happens? An older person is on aggressive medications targeting very low numbers. Their blood sugar drops. Their body doesn't warn them. They don't feel it coming. And then they fall. A fall at 70 is not a fall at 40. A fall at 70 can mean a broken hip. And a broken hip in an older adult can completely change the trajectory of someone's health and independence. Dorothy was 71. 12 years of type 2 diabetes, 3 different medications, checking her blood sugar 4 times a day. Doing everything right. One morning she woke up feeling off. Didn't recognize it as low blood sugar. Stood up, got dizzy, fell in her bathroom, fractured her wrist. Her confidence in living independently was shaken for years. Her new doctor told her something that stunned her. At your age and with your health profile, we may have been aiming too low. The target right for you at 55 is not necessarily right at 71. Major diabetes organizations now acknowledge that in older adults, particularly those with other health conditions, more relaxed blood sugar targets may be not just acceptable, but actively safer. If you're over 65 and managing diabetes, ask your doctor directly, are my blood sugar targets appropriate for my age? Is there a hypoglycemia risk from my current medications I should know about? These are not difficult questions. They are smart ones, and a good doctor will welcome them. Checkup number 4. Routine bone density scans, leading to unnecessary medication. The scan itself is harmless, painless, quick. The problem is what often happens after it. A DEXA scan measures how dense your bones are, comparing them to the peak bone density of a healthy 30-year-old. And here's where something quietly unfair begins. Almost every woman, and many men, at 65, 70, or 75 will show some reduced bone density compared to that 30-year-old standard. That is simply how aging works. Bones naturally become less dense over time. But once that T-score is classified, You get a diagnosis: osteopenia or osteoporosis. And very often that leads directly to a prescription for bisphosphonate medications. These medications can be genuinely life-saving for women who have already had fractures or have very severe osteoporosis with multiple risk factors. But here's the hidden issue. For women with mild to moderate reduction, who have never had a fracture, are physically active, eat well, and don't smoke, the long-term benefits may be quite modest. And the potential side effects with very long-term use are real. Rare but serious conditions affecting the jaw and thigh bone. Significant digestive problems. And because these drugs are prescribed so routinely, many people take them far longer than necessary. Eleanor was 68 when her first DEXA scan showed mild osteopenia. Her doctor immediately recommended medication. Eleanor took it for 7 years, never had a fracture, walked regularly, ate well. When she finally asked a specialist if she still needed it, the answer surprised her. "We may have been treating a number rather than a real clinical need," the specialist said. "A medication holiday is entirely reasonable. If you get a DEXA scan, ask your doctor to calculate your actual fracture risk using a tool called FRAX, not just the T-score alone. And remember, weight-bearing exercise, calcium, vitamin D, and fall prevention have strong evidence behind them, zero major side effects, and benefits that go far beyond your bones." Checkup number 5. Routine. Cardiac stress testing in older adults with no symptoms. When it comes to the heart, most of us feel more information is always better. More testing is always safer. Here's where that thinking gets people into trouble. A cardiac stress test is a powerful tool, for the right reasons. Chest pain, unexplained shortness of breath, palpitations. These are real symptoms that absolutely warrant investigation. But routine stress testing in an older adult who feels completely fine, just to be safe, this is where the cascade starts. As we age, normal changes in the cardiovascular system, stiffening blood vessels, minor electrical changes, small areas of reduced flow from decades of living, start showing up on cardiac tests. These findings are common. They would never have caused a symptom, never changed the quality or length of someone's life. But once an abnormality appears, the next step is more invasive. A nuclear scan. Then often, a coronary angiogram, a catheter threaded through an artery into the heart's blood vessels. Each step carries real risk. The contrast dye can affect kidney function, and kidneys are already more vulnerable in older adults. And here's what's deeply frustrating. Studies have shown repeatedly that in patients with no symptoms, these testing cascades and the procedures that follow do not reliably reduce heart attack or death rates compared to medication and lifestyle change alone. Gerald was 68 when his cardiologist suggested a routine stress test during his annual physical, just to have a baseline. No chest pain, no shortness of breath, no symptoms whatsoever. Mild high blood pressure managed with one medication. The stress test showed a minor abnormality. This led to a nuclear scan. The nuclear scan led to an angiogram. The angiogram showed borderline narrowing. Gerald ended up with a stent, a year on blood thinners, and months of anxiety that disrupted his sleep and his relationships. When he sought a second opinion, the cardiologist told him quietly, "For borderline narrowing with no symptoms, the evidence is clear that medication alone would have been just as effective. The procedure may not have been necessary. Major cardiovascular guidelines now explicitly say that routine stress testing in low-risk, symptom-free patients is not recommended because the harms outweigh the benefits. Real cardiac warning signs, chest discomfort, pressure, tightening, shortness of breath with normal activities, dizziness, fainting, these deserve immediate medical attention. But a routine stress test for a symptom-free older adult? Have that conversation with your doctor before you agree." Here's what all 5 of these checkups share. They are triggered not by symptoms your body is sending, but by a calendar, by routine, by habit. Your body after 65 is an extraordinary communication system. It speaks differently than it did at 40, but it is speaking. And the signals that truly matter are real symptoms. New pain lasting more than 2 weeks, unexplained weight loss, persistent fatigue, new changes in bowel or bladder habits, unexpected swelling, vision or cognitive changes. These are worth chasing. These are what prompt targeted, appropriate investigation. The question is, never should I see a doctor. The question is, Are we testing because something is actually wrong or because it's on the schedule? That one question changes everything. So what should you do instead? Here's a simple daily foundation with real evidence behind it. Walk 30 minutes every day. This alone improves cardiovascular health, bone density, blood sugar control, and mood. Not a pill, not a procedure. Walking. Eat protein at every meal. After 65, muscle loss accelerates. Protein slows this process. Eggs, fish, chicken, legumes, dairy, at every meal. Strength training twice a week. Bodyweight squats, wall push-ups, step-ups. Resistance exercise is the single most powerful tool for maintaining bone density and muscle mass in older adults. Sleep 7 to 8 hours. Sleep is when your brain clears waste, your heart repairs, your immune system rebuilds. This is not optional after 65. Stay connected. Purpose. Relationships. Laughter. The research on longevity is unambiguous. Social connection extends life. Period. And keep the medical checkups that genuinely matter. Blood pressure, cholesterol, kidney function, eye exams, dental care, colorectal screening, hearing tests, vaccines, flu, pneumonia, shingles. These are evidence-based and genuinely valuable at every age. The goal is not less care, the goal is smarter care. In the first week of making these shifts, most people feel something unexpected. Calm, no waiting for results, no cascade of follow-up appointments, no anxiety over a borderline finding. Just peace. In the first month, the foundations start working. Better sleep, more energy, improved mood, blood pressure beginning to respond. Within 3 months, real metabolic changes become measurable. Not miraculously, but steadily, meaningfully. Within 6 months to a year, quality of life shifts. Not just numbers on a report. The actual experience of being alive, energy, independence, confidence in your own body. The body over 65 is not broken, it is not failing, it is adapting. And when you give it what it truly needs, it responds. Before we close, please hear this clearly. Everything shared today is educational information based on publicly available medical evidence. It is not personal medical advice for your specific situation. Do not change any medication, cancel any scheduled test, or alter any treatment plan without a thorough conversation with your doctor. What I'm encouraging is this: become an informed, empowered participant in your own care. Ask why a test is being recommended. Ask what the potential benefits and harms are for someone your age. Ask how it applies to your specific situation. A good doctor will welcome every one of those questions. And if you have real symptoms, new, persistent, concerning physical changes, see your doctor promptly. That is exactly when medical care matters most. Here's what I want to leave you with. For too long, the story of aging and health has been a story of decline, of catching disease before it catches you, of testing and medicating your way through your later years. But there is a different story, and the evidence increasingly supports it. Your body, at 65, at 70, at 75, has an extraordinary, underestimated capacity for resilience and vitality. Not because you've been tested enough, but because the fundamental biology of your body still responds to movement, to nourishment, to rest, to connection. The goal isn't to find every abnormality and pursue it. The goal is to live well, to feel well, to stay independent, engaged, and fully alive. You are not a T-score. You are not a PSA number. You are not an HbA1c value. You are a whole person, making choices about how you want to age. And that deserves full information, deep respect, and your own courageous wisdom. Your body has carried you this far. Give it what it truly needs. Listen to what it actually tells you, and walk into every medical appointment knowing that you are the most important voice in the room. Thank you for watching. If this changed how you think about healthcare after 65, share it with someone who needs to hear it. Take care of yourselves, and I'll see you in the next one.